What do you like about the snatch video that we just recorded?
I was very impressed with the technique. I think it's a great overall strengthening maneuver. I definitely like the kettlebell version better than the dumbbell version as far as safety and just helping people who are a little bit restricted in their mobility.
So as like a physical therapist, right? You deal with a lot of people doing CrossFit and high intensity movements. Was there anything that you saw that would make you a potential client in terms of technique and what then look as safe?
For your specific movements in these videos, I saw you arching a little bit excessively through your mid-back. So I'd want to correct
Where was that done?
In this portion when you were lower in your squat movement and your arm was going overhead. So you're getting a little excessive arch through this area. Yep.
Okay. And why is that a big issue to worry about?
You get a repetitive stress through all your kind of thoracolumbar joint sections through here, which can just cause a lot of soft tissue and joint-related stresses, eventually lead to mechanical breakdown of the joint.
Is there anything you could tell our viewers who may be doing that and not aware, like symptoms they would feel if they're going in that direction?
That is a great question. I believe you would start to feel a general achiness in your low back, actually, even though the mechanical stress is occurring in the thoracolumbar junction area.
And for us non-physical therapists, that would be?
Through here.
Okay.
I believe you would start feeling it down lower in the body, just due to all the compensatory activation.
That there was a good kind of warm-up exercise I can do before I'm doing overhead movements like the snatch.
Yeah, to wake up the abdominal stabilization system, let's have you lie on your back with your knees bent. In this position, you can just see where he's a little bit elevated off the table. And so this warm-up technique is to kind of help get his back to stabilize down towards the floor. So we're going to use his abdominal cylinder, we're going to refer to it, which is the lower rib cage area from the diaphragm all the way down to the pelvic floor. So you're getting the whole abdominal content to kind of activate and help stabilize the spine. So
we call this a Buddha breath technique?
We call it the Buddha belly.
Buddha belly. Okay.
I actually don't know where the term came from. We just kind of started using it.
Pushing out your belly.
Yes. So basically, the way I coach our clients in the clinic to do this is I coach you to inhale. And on the inhale, you'll notice that your belly elevates. And you want to maintain that elevation as you exhale. So go ahead and exhale and try to maintain the pressure out of your stomach and even try to get the lower abdominal wall. So Paul here is actually a little bit weaker on the right side when he's trying to maintain it. He's not activating as strong. And so the goal here, we just do this for, I'll have our clients do this for about 2 minutes. You're working on keeping that Buddha belly engaged while you're doing some breathing. You actually want your arms by your side just like Paul is doing. And this is just a really introductory position just to help flatten out that junction area. And I can actually feel him a little bit closer to the ground there. And what we want to do to see if we were effective is actually get his legs off the stool and see if he's still closer to the ground.